Regarding the floor of the fourth ventricle, a longitudinal median sulcus divides the floor of the fourth ventricle into two halves. Each half is divided by an often indistinct sulcus limitans into a medial region known as medial eminence and a lateral region known as vestibular area. The vestibular nuclei lie beneath the vestibular area. In the superior part of the ventricular floor, the medial eminence is represented by the facial colliculus, a small elevation produced by the underlying lobes of the efferent fibers from the facial nucleus, which covers the abducent nucleus. Between the facial colliculus and the vestibular area the sulcus limitans widens into a small depression called the superior fovea. In the inferior area of the floor of the fourth ventricle, the medial eminence is represented by the hypoglossal triangle or hypoglossal trigon, which lies over the hypoglossal nucleus. Laterally, the sulcus limitans widens to produce an indistinct inferior fovea. Caudal to the inferior fovea between the hypoglossal triangle and the vestibular triangle is the vagal triangle or vagal trigon, which covers the dorsal vagal nucleus. The roof of the fourth ventricle is formed by superior and inferior medullary villi. Superiorly, a thin sheet of tissue, the superior medullary villi, stretches across the ventricle between the converging superior cerebellar peduncles, which forms the superior lateral borders of the fourth ventricle. Inferiorly, the inferior medullary velum is mostly composed of a thin sheet devoid of neural tissue formed by the ventricular epididyma and the via mater, stretched between the two inferior cerebellar peduncles that form the inferolateral boundaries of the fourth ventricle. This figure shows the floor of the fourth ventricle as described before. In the roof of the fourth ventricle, there is a large median aperture called foramen of Magendie. Is present in the roof of the fourth ventricle as perforation in the posterior medullary velum just inferior to the nodule of the cerebellum. Cerebrospinal fluid flows from the ventricle through the foramen of Magendie into cerebellomedullary cistern. This is a sagittal section showing the brain ventricles and subarachnoid cisterns. Thank you.